Good morning to all of you. On behalf of Department of Medical Imaging Sciences, Gulf Medical University, we would like to take the pleasure to invite all of you for this webinar series in medical imaging sciences. Thank you all distinguished speakers who have accepted our request and have given your consent to deliver and share your thoughts with the professionals across here. Thank you very much. To initiate these procedures, I would like to request Professor Mustafa, who is from University in Saudi Arabia, to kindly deliver his talk. Good morning to Professor Mustafa. Thank you very much for joining in.
Thank you very much, Doctor. Foremost, I would like to thank the Gulf Medical University for inviting me to give this lecture. As a result, our topic today in this webinar about series in imaging sciences will be principles of ultrasound homology and practice for radiodiagnostic technologists. And actually, this lecture is part of Gulf Medical University's ongoing effort to improve and raise the level of performance by providing specialized and high-quality lectures to medical staff specializing in medical imaging. And actually, in front of you, here is my presentation. As I said shortly, it will be principles of ultrasound homology and practice for radiodiagnostic technologists. And actually, through this lecture, I will show you several tips and tricks of how to deal with the ultrasound machine correctly and exactly to avoid any misleading work or any mistake. With the sake to help the practitioners radiology and in their subspecialty of ultrasonography to dealing exactly and well with their machine. Also, I would like to introduce myself. I am Professor Mustafa Mahmoud. I'm a professor and consultant of ultrasonography. I'm working at Prince Tamir Abdulaziz University at the College of Applied Medical Sciences, and I'm from the Radiology and Medical Imaging Department. So let's start our talk together. And I would like to open this lecture by stating some learning objectives that we are going to achieve from our lecture. The first learning objective that we are going to achieve from this lecture, actually this lecture will inform about the principles of ultrasound homology and practice for radiodiagnostic technologists. In addition, the lecture will answer a question about what is in the scanning room. Before we start showing the points of our talk today, I would like to add two informations in two directions. The first one is a fact, which is stating that ultrasonography is a highly operator-dependent imaging modality with a number of homology variables that are under the control of the operator. And when we come to the definition of the term homology, we are going is a terminology which describes the manipulation of ultrasound knobs and system control in order to obtain the best image possible from diagnostic ultrasound. So after listing this fact and this definition, the fact was about ultrasonography, and the term homology as a term related to the title of this lecture, I would like to give information about the lecture outlines. And actually, the lecture outline are as follows. In point 1 and 2, I will discuss the ultrasound monitor and ultrasound scanner. Point 3 is devoted to ultrasound scanner maintenance. What controls or what knobs are required in the scanner? This question will be addressed in point number 4. Also, as shown in point 5 and 6, this 2 point will be about recording the ultrasound image sorry, and selecting the appropriate transducer. This will be discussed. Another query that will raise in point number 7 about this question, what is needed in the ultrasound scanning room, I will address throughout this lecture the answer for this question. And finally, all the preceding points, starting from number 1 to number 7, this will be summarized in the final section of this lecture, which is devoted to the summary. So let's start our points of this lecture by discussing the monitor. And when we start discussing the monitor, all of us, we know that the monitor, it can be named as the viewing screen. It take it analyze and interpreted it or show it or shows the resulting image of the scanned area. And here we have a combined image with this slide. If we concentrate well, we can see this image showing us the major or the main component of our ultrasound machine. And you can notice that the arrow here is showing you the monitor, without forgetting another important part as the transducer. And actually the transducer is the heart of the ultrasound machine, which is coming in contact with the patient body during ultrasound scanning. And we should have a keyboard to be in communication with ultrasound machine, information, and the ultrasound machine is going to translate this information to its the image is going to be presented in analog mode in the monitor. Machine, and you can see that in the monitor there are several information between them. We can see this ultrasound image, and you can notice this is the area referring for the liver, and here we have the kidney, which was scanned through color Doppler ultrasound examination in a kind of examination known as perfusion testing for the blood in the vessels of the kidney. So this is how information is going to be presented in the monitor, which is the first part when we talk about knowledge of the ultrasound machine. Much more regarding the monitor, there is a standard dimension for the monitor, which has been stated by the WHO, which is the World Health Organization, and saying that the dimension for the monitor must not exceed 13 centimeter multiplied by 10 centimeter, which is diagonally about 16 centimeter. And the combined image here was taken from a reference known as Manual of Diagnostic Ultrasound, which is one of the famous references in the field of ultrasonography. And it under the supervision of the World Health Organization, and it stated such information. But as you know, in today's life, ultrasound machine have been developed a lot, and now we can do ultrasound examination in a small kind of mobile machines that are mobile from here with a smaller dimension monitor. But what I mentioned here regarding 13 centimeter multiplied by 10 centimeter, these are the universal measurements that we shouldn't exceed in our ultrasound machine. So this what is regarding point number 1, and as I said, as I stated, point number 2 will be dedicated to a talk about the ultrasound scanner. And ultrasound scanner actually should be portable and light enough to be carried by hand for 100 meters, and must be suitable for use in the local climate. All this information you should reassure available at your ultrasound scanner. And here you can see this is a kind of a modern new ultrasound scanner, which is portable. It can be held by hand, it's light enough. And here we come to the view when we lock down the monitor, and you can see here it can be handled from this handle easily from one area to another. And again, your scanner should be suitable to the local climate where your scanner is going to be used. Much more I will add for you. Additional image describes the development and the new era in the development of the ultrasound machine. And you can see here now we coming with this pocket holded ultrasound machine, and here we can program a smartphone by introduce a specific program, and then we can connect it, the ultrasound transducer, with our mobile phone or with our smart mobile phone through wireless, and easily you can convert your mobile phone to an ultrasound machine in case you have a transducer to be connected through wireless, and again if you have the program or the app that is suitable for such an issue. In addition, more fact and more important point for the practitioner they should follow, and we can add this fact by scanner must be tough enough to withstand and transport and storage condition. Also, our scanner must operate satisfactory without any complication from the power supply in your hospital or in your private clinic. And here you can see the block diagram of the electric circuit by which your scanner is connected, starting from the power supply, and then inside this sophisticated circuit of the scanner. So point number one and point number two had been discussed successfully throughout the flow of this lecture. And now we can move directly to point number C, article, which is about servicing the scanner. And we can start selling in this point by saying that servicing the scanner must be available within a reasonable distance. And here I have a wise talk. If you decide to buy an ultrasound unit, you should make sure that the ultrasound unit that you buy is similar to the scanner available. And this is wise. Why? Because if you buy a scanner that is the same as ultrasound machine available at your area, it will be sufficient in the direction of expertise that could be translated between each another, and again the availability of the spare part. So you haven't if you bear cash an ultrasound machine that is similar to other machine available at your area, and this talk can be vice versa if you buy an ultrasound machine that is unique and doesn't use before at your area. And by area I mean the neighboring hospitals or the neighboring clinic at where you are working. To this inquiry which was raised at point number 4, and this inquiry is appear in a form of question which asks what are the controllers needed in the scanners, or what are the controllers or what are knobs that we should reassure they are available at our ultrasound machine or that are available at our scanner. Starting answering by saying that the first knob that we should make sure that it's available at our ultrasound machine is a knob known as overall sensitivity control. And this is one of the important knobs that should be available at your ultrasound machine. And from its name, it controls the sensitivity. This kind of knob should be available here at the side of the monitor, and you can increase and decrease the sensitivity of your ultrasound machine during your ultrasound examination. Several parts such as high resolution LCD, liquid crystal display, and quick key control, and you can follow the rush of information in the accompanying image. So this is the knob number 1 that we must reassure it's available at our ultrasound scanner. Our ultrasound scanner have to have a separate control, and this separate control is coming with a function to alter the near and deep echoes, and such separate control known as near gain and far gain. What about gain? What about near gain? What about far gain? This information is here in slide number 18 in this part. It's a way to overcome ultrasound attenuation. Now another point raised here, which is attenuation, and as you already know that attenuation is a loss of energy during ultrasound examination is ongoing, and this loss of energy is increased as ultrasound passes inside the human body, and such form of losing of energy during ultrasound scanning must be compensated, and the compensation is coming by this key which is known as time gain compensation. And you can notice here we can alter the near gain and far gain separately at a specific area that we choose through these knobs related to this time gain compensation, and we can control the gain totally not separately as appear here by this control, which is named as gain control, and you can revolve this control, and it will alter successfully the gain completely. So this is another control, or this is the second side, the first control, which was the overall sensitivity control, and this control, which is the second control, is a separate control to alter the near and far gain, or to alter the gain totally by a controller named as gain control. Much more beside these two controllers that I mentioned, I would like to add another controller, and the another controller which is so important to be available at our ultrasound scanner is a control named as frame freeze, or a freeze knob. And this freeze knob is used to hold the image on the screen so that it can be viewed for as long as necessary. It can be a kind of knob available at the control panel or at the control console of our ultrasound machine, or it can be a kind of controller in a form of foot switch, and by your foot you can press at it to hold the frame, or to make the image hold it in the on the screen freeze for a long time so that you can view it and do operation necessary. And in our accompanying image here, you can see this is controller here. Again here in this machine, and as I mentioned, instead to be a knob available at the control console, it can be to apply the action of freezing of the image. The force control, which is so important also, as the previous mentioned controllers, is a control to measure the distance between 2 points. And if you have such kind of, easily activate what is known as biometric table. And this biometric table is a kind of table that is used muchly at obstetric ultrasound examination. And if you can see in this image, an image was taken for the fetal head. You can see the two parietal bone, and you can measure the distance between the two parietal bone was measured by using this control, which is aimed to measure the distance between 2 points. You can notice here the distance is about 91.1 millimeter, which is about 9.4 centimeter. And this is going to be analyzed by the CPU, or the central processing unit of the ultrasound scanner, to give you what is known as the pi. And the biparietal diameter is one of the most famous measurement that is going to be used during obstetrical ultrasound for a pregnant lady, especially in the second and the third trimester, to predict the expected date of delivery. So when you measure this distance, ultrasound machine, the information that you supplied, and it gives you an information here that the biparietal diameter is equivalent to 38 weeks. So this lady is the 38th week of pregnancy, and she's going to be delivered, or expected date of delivery is on 25th of September 2013. So, I think right now it's clear for you why we should have a control to measure the distance between 2 points. And we can add much information regarding the biometrical table of obstetric by looking at this image. And you can see here we have measured the distance for the shaft of the femur. And this, if you concentrate it about 50 millimeter, 0.1, which is about 5 millimeter, and this is going to be understood by the ultrasound machine to be equivalent to 27 weeks. We have measured from the beginning of the femur till the end of the femur, from the epiphysis of the bone, and here we measure what is known as FL length, or what is known as femoral length. Much more we can talk about the fifth controller or knob that should be available at our ultrasound machine, or on our ultrasound machine, and this is a knob for applying what is known as continuous and pulse Doppler ultrasonography, especially in echo. And you know that in echo we should deal with continuous Doppler ultrasound examination, but if we would like to examine the vascular system, use pulse Doppler ultrasound. And here you can see there is a color box revealing that there is a blood flow inside this blood vessel, and we can get the signature of this blood vessel by applying what is known as ultrasonography. And this image here is taken from the heart chambers, and it's a kind of echocardiography under the application or initiated by the application known as continuous Doppler ultrasonography. And here, when we use color Doppler, we can see that there is a blood clot or there is a thrombus inside this blood vessel. All this information or all this available information will not be available for you if your ultrasound scanner doesn't contain a controller or knob that control or deal with continuous and pulse Doppler ultrasound examination. So question or the inquiry which was raised at point number 4, about it by mentioning a 5 or 6 form of controllers which are vital controllers that should be available at your scanner. Now we come to point number 5, and we are in the middle of this lecture. And point number 5 regarding the recording of the ultrasound image. How can you record your this question is going to be answered in balancing the cheap with expensive. And I would like to bring to your information that the best and most expensive method to recording your ultrasound image is to use an X-ray film. But actually, if you like to use the X-ray, facilities are on need. The first facility is an image processing unit combined with a special camera, and for sure, this make this kind of recording the ultrasound image a very expensive tool for recording your information for a long period of time. So to think for another way that is cheaper and more practical. And the another form to recording your ultrasound image, which is the next best method, but it's also expensive because it's require a self-processing camera and film, and this should be attached. Much more, the third and the mostly used method to recording your ultrasound image is to record your ultrasound image in a special thermal paper. And this special thermal paper are coming in this package. You open this package and you will find a roll of thermal paper, which is going to be introduced in this specialized device, which is known as ultrasound printer. And from here, this green knob, you can print your screen. But here raised a problem, and this problem is associated with the thermal paper itself. Thermal paper, the information in thermal paper is going to be subjected to loss if they are not protected from excessive heat. So if you protect the information which are documented in this thermal paper from heat and light, it's will be good, and it's for the sake of the information of the patient. And as I mentioned, this is the famous form of recording the ultrasound image. Information to articulate the idea well in your mind, and you can see in this package here we have the thermal paper, and this is the thermal paper when it was removed from its package, how it's looked. If all this mentioned 3 methods of recording the ultrasound image is not available for you, another way, and the another way also it's not a practical way, it's by photographing the monitor itself, which is containing the ultrasound image, by using this camera, which is 35mm camera. But actually the main problem of this method of recording the ultrasound image is that processing the film inside this camera will take time, especially if you are in a rural hospital. If all the previous method of recording the ultrasound image is not available for you, directly start to fill the ultrasound form, which is presented to you here, by all the information that you see. And you can see here he mentioned prostate gland is enlargement. He gave us information about the kidneys. Also here he come to conclusion grade 3 enlargement of the prostate. If you having to recording your ultrasound image for a long time. So this was regarding point number 5, and I'm going to move to point number 6, which is regarding how to choosing the appropriate transducer. And as I mentioned earlier in this lecture, is that ultrasound transducer is a part of the ultrasound connected directly to ultrasound machine, and it's come in touch with the body of the patient during ultrasound scanning. And as you see in this image, we have a pregnant lady, and here the ultrasound transducer is touches directly to the skin of the patient during ultrasound scan. We should reassure that our ultrasound machine contains which is ultrasound transducer, and actually transducer appear in different form according to the applications that they do. And for example, here you can see this is a kind of ultrasound transducer known as linear ultrasound probe, while this kind of ultrasound transducer is known as curved linear ultrasound. People who are expert in ultrasound know that this kind of probe produce high frequency, and when it produce high frequency, it's associated with high resolution image in the ultrasound monitor. And also the expert knows that this type of probe known as convex probe or curved linear probe, it produce a less frequency, but it gives us the ability of penetration. While ability of penetration is not available well in this type of ultrasound transducer, which is known as linear transducer. So if you are interested to do obstetric ultrasound examination by your scanner, you should make sure that your ultrasound machine is containing a convex ultrasound transducer. Also, there is a need for a linear transducer, making sure that this both transducer generated a frequency from 3.5 megahertz up to 5 megahertz, and they are well focused at 7 to 9 centimeter. And we mean by well focused, the central zone in the ultrasound beam profile is focused at 7 to 9 centimeter from the skin of the patient. And also transvaginal ultrasound transducer is much important to be available if you are interested to scan obstetrical ultrasound, especially in the early stage. And it's so important to have a transvaginal transducer for gynecological ultrasound. And here how the transvaginal ultrasound transducer look. It comes with a smaller footprint crystal comparing to the previous forms of ultrasound transducer. This is going to be introduced through the vagina, but before introducing through the vagina, we should and avoid any kind of disinfection that is going to be, or infection that is going to be occur for the patient. And you can see the accompanying image here, which has come from introducing this kind of ultrasound transducer. So from the previous talk, we mentioned that if we on need for obstetrical gynecological ultrasound examination, to have three kind of probes, which are linear probe, curved linear probe, and transvaginal probe. For general purpose ultrasonography, especially if we would like to scan the upper abdomen in adult and pelvis, we have to have a sector or convex transducer. And you can see here, this is a kind of curved linear probe, kidney and liver. And you can see here, this is the right lobe of the liver, and this is the right kidney, from where you can compare the echogenicities of the right liver lobe with the right kidney to diagnose any cases of pathology, especially a famous type of pathology known as fatty fibrotic in the liver, or what is known as fatty liver. And in this image, you can see the three forms of ultrasound transducer. We mentioned linear array, we mentioned curved array, but this kind of probe is known as phased array transducer. And as we are going to see shortly, it's a specialized kind of transducer. The areas that are obscured by the ribs, because it has the ability to send ultrasound beam between the ribs, especially in the intercostal spaces. And it's a great value probe that is going to be used especially in echocardiographic examination, as I will show you shortly. Also, at your ultrasound department or at your hospital, if you are interested to scanning pediatric patient by ultrasound, you should make sure that for children a 5 megahertz linear transducer is on need, because we happen to penetrate a deep area at the body of the pediatric. You can see here the distance of the trunk is so short if it's compared with the distance of the trunk in an direction. And we have to have a sector and convex transducer, and you can see here this is and here we have a scanning for the brain through an application known as transcranial ultrasound. We introduce ultrasound beam through the anterior fontanelle and posterior fontanelle to diagnose any cases of hydrocephalus or accumulation of cerebrospinal fluid inside the ventricular system of the brain. And if your ultrasound hospital is interested or is specialized in echocardiographic examination, as I mentioned shortly, you should make sure that there is an availability of this kind of ultrasound transducer, which is known as sector probe, and it used to examine adult cardiac or pediatric cardiac with about 5 megahertz and more. It's a kind of ultrasound transducer produce a fan-like image with the ability to introduce the ultrasound beam through intercostal spaces between the ribs. Also, small parts by ultrasonography. First of all, before starting discussing this point, we have to know that small part, I mean by them, the breast, thyroid, and testicles. If you are intended to scan the breast or scan the thyroid or scan testicles, you should to have a high frequency linear ultrasound transducer. There is a lesion inside the breast. It was detected by using a high frequency transducer, which is a linear transducer focused at 7 to 9 centimeter. And here, this is the right testicle as shown. And here we have the thyroid gland. Here is the trachea. This is the right and left lobe of the thyroid junction with each another. The thyroid isthmus. So by reaching this slide, which is slide number 38 from the beginning of this lecture, we have addressing several information starting from point number 1 to point number 6. I will remind you them again quickly. The first point was dedicated for the monitor, the scanner, and several tips that should be available at your ultrasound scanner without forgetting point related to servicing the scanner. And we had seen that it wise to buy an ultrasound machine that it's well known at your area to translate the expertise between you and your colleague, and again to make sure that the spare parts are available for you easily. Also, I answer a query raised in point number 5 about what are the controllers or knobs needed in your scanner and how we can recording the ultrasound image. Without forgetting that in point number 6, I address information regarding choosing the appropriate transducer. And right now, I'm ready to answer another query which was raised for us right about what is needed in the ultrasound scanning room. If we talk about the ideal designation of the ultrasound scanning room, what do you think designation? Start answering by giving you a chance to look at this image, which is showing you an ideal designation of your ultrasound room. And if we come to mention them, this is a bit where our patient is reclining comfortably during ultrasound examination. And here we have our scanner. As you know, this is have a keyboard, and this area here is containing the central processing unit or the brain of this machine. And here this is an area for reporting station. After you complete your scanning or your examination and you recorded the needed image, you come here to this reporting station to write your report, and you can through the hospital system. Also, there is a facility for washing hand, and we have this cupboard where we can store our gadgets that are related to the ultrasound machine. Also, there is a ventilation with adequate lighting. All this information that I mentioned for you is of the suitable designation of ultrasound scanning room, and let put the information in the right direction by saying that there should be facilities for washing hand, provided drinking water, and there should be a toilet nearby. This is point number one about the suitable designation of your ultrasound room. There should be a window or some other form of ventilation with adequate lighting. And by adequate lighting, I didn't forget to say that there should be a dimmer. And the dimmer is a kind of a knob by which you are going to increase the brightness of your lighting or decrease the brightness of your lighting, depending on the idea is done in a dark room or with an adequate lighting that is not a hindrance for you to looking at your ultrasound monitor while you are scanning your patient. Much more regarding the suitable designation of your ultrasound scanning room, I don't forget to mention that standard electric be available so that your ultrasound machine can be operated directly from it. And as you see here, this is your ultrasound scanner, and in the background you saw that the ultrasound scanner is junctioned directly with electrical outlet, for example 20 volt with 5 ampere or 110 volt at 10 ampere. And again, your room must keep dry and free from dust. And we are free from dust because we are dealing with a sophisticated ultrasound machine that is going to be affected by dust. And again, your room should be dry to avoid any kind of electrical shock that is going to be generated accidentally if you didn't take care to point or to this point, which is appear at the beginning of this slide. Much more, our room should be big to withstand or to accommodate with a scanner and the couch, also a chair or a small table or a cupboard that should be available. Also, the couch where our patient is reclined should be for sure a comfort patient. And here you can see a map how the ultrasound room or how our ultrasound scanning is suitably designed. Let's skip this. I'm going to move to the last point in the lecture of today, which is about summary. And as I stated at the beginning of this lecture, in the final step, preceding point will be summarized in the final section of this lecture, which will be devoted to summary. Okay, what about the summary for this lecture? The first point in this summary is saying that the inadequate use of knowledge variables impair image quality, and this for sure is right, because if you didn't know how to use your knowledge well, you couldn't machine in a right way. Much more, the practice of using high output power should be limited because the risk of biological effect, which is going to be raised when we scanning in high output power by our ultrasound machine. Much more, you should choose scanners that will perform the examination needed, and there is no justification for buying accessories or gadgets that are not likely to be used very often. In case of inquiry, please feel free to contact me. And if you enjoy this lecture, please click the like button. Furthermore, you can share button, ensuring that this streaming reached the widest possible audience. And to receive all new updates, you can subscribe at my YouTube channel under the name Prof. Mustafa Zuhair Mahmoud. It appears for you right now on this screen. If you have any question, please contact me on my personal page, Mustafa Zuhair. For much more, you can follow me on Snapchat, and my account in Snapchat is presented for you also. And you can send message or call me via WhatsApp or phone, as my phone number are displayed on the screen. And finally, also, you can contact me via email through my email at Hotmail. And here, this slide is the slide for the references I used to prepare for this lecture. I would also like to mention the second link between the references, which is this link. And this link is for World Health Organization book, which is Manual of Diagnostic Ultrasound that I mentioned it in the previous slide, which is published with the goal of guiding health professional on the safe and effective use of ultrasound, from which I learned a lot. So if there is any question or inquiry, I'm ready to get your question. Kindly you can ask.
Thank you, Professor Mustafa, for a very elaborate and detailed presentation. The audience can type in the questions, which I can read into Professor Mustafa, and sir will be ready to answer the questions in the next couple of minutes. Professor Mustafa, there is a question for you. Professor Mustafa, thank you for the detailed presentation on the knowledge of the ultrasound system. My question is how to prevent probe damage, for example, from short circuit. Is there any tips for users on how to handle probes in a safe manner?
Okay, this is a good question. Thank you, dear doctor, for letting me present this lecture today. I would like to thank you again. And it's asking about the safety use of the ultrasound scanner. Let's start from the sterilizing of ultrasound scanner itself. As we already know, that ultrasound scanner is not going to be sterilized by heat. It's a kind of chemical sterilization by using the available sensitizer between patient. This is so important. And again, avoid your scanner to fall down while you are scanning. And this is the kind of safety guard that you are going to wear at your hand while you are scanning patient to avoid the scanner to fall down. Because if the scanner, if the transducer, I'm so sorry for this, if the ultrasound transducer is scanning, there is a chance for cracking the crystals. And if a cracking occurs to the crystal, for sure, your ultrasound transducer is useless. And again, the question is concentrated about how to control the electricity. Actually, you should have a stabilizer here between your ultrasound scanner itself and the electrical outlet that is going to organize the electrical current that is entered at your ultrasound machine while you are working. This is the answer of your question. I hope that it's clear for you right now.
Thank you, Professor Mustafa.
Okay.
There's one more question. How to do safe infection control measures for the probes and the unit as a whole?
Yes, especially right now we are in corona pandemic. This is so important because you know that the ultrasound probe touches the body of the patient, and it can infection. It can take bacteria or germs from here and there. So the safety measure or the infection control that you should apply, as I mentioned shortly, between patient, especially if you end the scan and you are intended to start a new scan, you should clean the footprint of the ultrasound transducer with a sensitized gel to avoid any kind of infection that is going to be transferred to a patient. And there is a kind of general sterilization to the room itself by disinfectant materials that is going to be used before and after your patient. This is it.
Thank you, Professor Mustafa. I'm reading to you the next question. Does the bed used in ultrasound room have any specifications like on wheels or side rails can be made vertical, etc.? Is the bed used in ultrasound has any specifications?
Oh, the bed that is used in the ultrasound. Okay, this is good. Yes, using ultrasound should contain a wheel for sure, and there should be a brick to fix this bed or this trolley where you are scanning the patient. Also, the end of the trolley should be raised. There should be an ability to raise your trolley while you are scanning your patient to make your patient comfortable. And also, you should make sure that there is a paper sheet that you should put on the trolley or the bed where we're scanning our patient to avoid any kind of infection transmission between patient during ultrasound scan. Okay.
Thank you, Professor Mustafa. There's one more question for you. Is there any difference between the ultrasound machine and the phone application ultrasound regarding the image quality?
Yes, this is a good question also. The question raised still in ultrasonography is the challenge of image quality in a form of resolution and image clarity and different form of resolution such as axial resolution or lateral resolution or temporal resolution. The new ultrasound machine or the new development that occur at ultrasound machine, as we saw as we saw in this lecture, you can make your smartphone a kind of ultrasound machine by installation of the app and conjoin it with the ultrasound transducer by wireless. Newly today application correctly address the limitation of resolution, and we come with a highly resolution ultrasound machine which is managed to resolve any problem of resolution that we are facing in the past. Especially, you know that ultrasonography is a new kind of ultrasound examination which was 1996.
Thank you, Professor.
You're welcome. You're welcome.
There's one more question for you. Do we need to freeze the unit for replacing the probes?
Yes, if you aren't scanning the patient, make sure to press frame freeze or to press the freeze button, because if you didn't push the freeze button, which is an important controller that should be available at your ultrasound machine, this means for the machine to produce ultrasound energy much, and this can decrease the lifetime of your ultrasound transducer. And as you know that the ultrasound probe or the ultrasound transducer is converting the electrical energy to ultrasound energy, and the returning echo for the patient is again going to convert from this form of ultrasound energy to electrical energy or electrical signal that is going to be read by the machine. So if you would like to save your ultrasound probe for a long time and avoid its deterioration or losing your crystal, you should freeze the frame by pushing the freeze knob between patients.
Thank you, Professor. Audience, are there any questions for you? Please send in the questions. Professor Mustafa is ready. All the audience are thanking you, Professor Mustafa, for a very good presentation and for also clarifying their doubts. Thank you very much. We'll just wait for 2 minutes if there are any questions.
Okay.
Okay, I believe there's one more question. Professor Mustafa, in relation to the current pandemic, what are the safety precautions to be used when doing ultrasound?
Yes, this is a good question, especially while at the time of pandemic. First of all, you should wear your mask and the personal protective devices. Again, social distances should be application between your patient, and you should raise the question of sterilization of the ultrasound room and the ultrasound machine between patient to avoid any kind of transmission of infection. This will make you yourself as a person safe and will make your patient also.
Okay.
Okay.
Okay, there's a question by one of the audience. Nowadays, there are a lot of sonographers doing the scan. Are they allowed to convey the results?
Yes, this is a good question. Actually, it's a question regarding the rights. And the answering of this question actually depend at the area from where you are doing your ultrasound examination. For example, if you come to UK, which is United Kingdom, it's allowed for the sonographer to write the report, and their decision in their report is a final thought. It's not going to be checked by a radiologist or etc. In United States, again, you know that it was certified for a sonographer to write his report, and in a rural area, he is a key person there. But in the central hospital, this report should be checked again by the radiologist. If the of the radiologist at the central hospital, you are the key person to do your ultrasound examination. Here in the Middle East, still this regulation wasn't clear. Here in KSA, I tell you about my experience. Are governed by the radiologist. They do the examination, and then the radiologist is going to confirm their report. And from my experience in my homeland at Sudan, sonographer are the key personnel at their area. If they are working at a central hospital or if they are working at a private, they are responsible for their report. Their report is a final decision that is going to be taken by the referral doctor. If we shed light at Australia till now, there is no permeability for sonographer to do ultrasound examination yet. This is I give you an information about the situation in UK. Also, I give you an information about the situation in the United States of America. I give you information about the situation in the Middle East and my homeland at Sudan. And again, I give you an information about what happened at Australia and New Zealand.
Thank you, Professor Mustafa. So the audience can have an idea that regarding the question, to convey the results, it is country based. As per the regulations of that country, the permissions are yes and no. There is no universal norm, I feel. Am I correct, Professor Mustafa?
Yes, as I said, here in Middle East still now, much work should be done in this direction by produce a highly practitioner. And deeply in my heart, I believe that in the coming days, this situation will change, and the sonographer will take their places, and they will take the decision. But they have to protect themselves first by doing a good and excellent and a satisfied form of work, without forgetting that the raised number of patients and the decreased number of the practitioners in the medical field, the permission will come shortly. But till now, still there is question about this.
Thank you, Professor Mustafa. So if there are no other questions, I would like to take this opportunity to thank Professor Mustafa for giving your valuable time and sharing your thoughts with the audience here. We value your contribution and we look forward to work with you in the near future as well. Thank you, Professor Mustafa, for joining in.
Okay, you're welcome. And as now we have reached the end of this class, sincere thanks and appreciation for your presence, and I hope to see you again soon in another lecture in the near future. I would like to thank you very much for giving me a chance to present with you here, and I respect your this chance. Okay.
Thank you, sir. Thank you very much. Thank you. Dear audience, thank you very much. We will progress into the next lecture. I have the privilege of introducing Dr. Hairil, who is from Malaysia, working an associate professor. I take this privilege of introducing Dr. Hairil. Good morning, Dr. Hairil. You are muted, sir. Can you unmute yourself? Yes.
Okay. So hello, Dr. Praveen.
Good morning. Good morning. We can hear you now. Thank you very much for joining in.
Welcome. So should I share my screen?
Yes, please. Please, you can go ahead.
Can you see the slides?
Yes.
Good.
Thank you very much, and you can go ahead. Dear audience, we will take the, you can type in your questions. As in the earlier session, we will take the questions at the end of Dr. Hiril's session. Thank you, sir. Please start ahead.
Okay. So just wait for a while. Let me familiarize with this thing. Because it's honestly, it's first time for me using this GoToWebinar.
Yes,
Usually
yes,
we use
this is
the
very commonly
Zoom
used in this part of
platform.
the group. You're on. You can just click for the next slide. It's on.
Okay. Okay.
Yes, please go ahead.
Okay. Good morning, everyone. First of all, I'm Hairil. I'm working with University Putra Malaysia, and then I have been posted to the Center for Diagnostic Nuclear Imaging, in which we have modalities such as a PET CT and also 3 Tesla MRI. So for this year, we are celebrating our first gold jubilee for the university, in which we are now 50 years old. So for today's lecture, basically, I just want to share, because I heard that just now you are talking, the previous presenter talks more about the technical part, but I'll try my best to keep this talk short and sweet as possible. And then I'm not go to the detail of the technical part, but hopefully at the end of the day, I would encourage the students, especially, and some of our the attendants to get the warmth of doing research, especially in medical imaging. So for today's lecture, basically, I just want to introduce to all of you about the latest area of research related with medical imaging. So there are some of new topics, the emergence of new technology into the field of medical imaging that I would share with you later on. And then also, I'm hoping that by having this lecture, the participant would have an interest, or by doing this, I can inculcate the research activity among newly graduated radiographer, or we call it medical imaging practitioners. So I believe the main agenda in our daily clinical setting is to give an accurate diagnosis for the patients. Why accurate diagnosis? Because we hope by having accurate diagnosis, we can give an appropriate treatment to the patient, in which at the end of the day, patient will have good prognosis. So in terms of areas, there are two major areas that I would say based on technology base, and the other one will be based on the clinical base. The technology base is basically all about the computer system, all about the image processing, all about the artificial intelligence. That's one is what we call it technology base. And then all the clinical one, nowadays we have heard about the precision medicine, some sort of personalized medicine. They are almost the similar terminology, but in detail, I will explain further in later slides. So this is basically our main agenda in clinical research, is basically to have an accurate diagnosis for the disease that we would like to detect. Why medical imaging is important? Medical imaging helps clinicians diagnose, treat, and understand a range of injuries, diseases, conditions, and including cancer, cardiovascular disease, musculoskeletal complaints, and also neurodegenerative disorders. In US, as per the latest statistics shows that the CT scans still the winner in terms of the modalities that being used mostly in 2019. You can see from here is almost 91 million of CT scan performed in 2019, followed by almost 42 millions of MRI scans, and lastly about more than 2 million PET scans. So usually, as we know that CT scans is the main contributor of medical radiation dose to the public, where we know that the most dangerous or the alarming issues is on the radiation is about radiation is as a carcinogenic agent, in which when we give the radiation to the patient, we should always abide with the radiation protection principle. As I think most of us are aware about the principle of justification and also optimizations. So in terms of imaging modalities, this slide basically shows about the range of imaging modalities available, not necessarily on the human, but also to the small animals imaging. So this basically just want to show there are a range of imaging modalities that we can use, especially as you can see from here, the PET imagings. What are the advantages of PET imagings? It gives you high sensitivity with unlimited depth penetrations, but is already available in clinical translation, meaning that it's already available in a clinical setting. However, the cost is quite expensive nowadays, and same goes with the specs. I think it's pretty similar with the PET, in which the only difference on the advantages of spec is unlimited depth penetration. However, the PET, in terms of image quality, the spec image has lesser spatial resolution as compared to the PET images. On the aspect of CT scans, is a common imaging modalities that available in the most of hospitals. I would say then it is already available in terms of technology, is already up to the standard where we can have multi slices, and nowadays they're talking about dual source CT scan and all those artificial intelligence incorporated with CT images, in which I will explain later in the next slides. So the disadvantages of the CT scan is no specific target imaging. It gives you the highest radiations from CT scan, but and also the poor soft tissue contrast as compared to MR imaging. So as we know that CT scan is mainly for the bone imaging. So on the aspect of ultrasound, I think it's similar with what being presented by previous speaker. The advantages is it has high spatial and temporal resolution with low cost, and then however, because it totally depends on operator skills, so it's sometimes the subjectivity of the images can be occurred, and targeted imaging limited to vascular component. And the second last one will be the MR imaging, in which already available in clinical setting with high resolution of soft tissue contrast, but the advantages on the imaging time and then the cost. And then lastly, the optical imaging is at the moment is only available for preclinical or animal imaging itself only, but is without the use of radiations. It's good thing about the advantages of the optical imaging. You can have high throughput screening of patient for targeted compound and a high sensitivity. However, the disadvantages is limited clinical translation, low depth penetrations. So you still can follow me, right? Dr. Praveen?
It's perfect, sir. Please go ahead. It's excellent.
Okay. I'm afraid because I'm afraid that because we are the new norm, so maybe because of the internet connection, you can.
No, please, it's going perfect.
Okay. So if anything, just let me know.
I'll do that.
At any time.
Thank you.
So this is basically just want to highlight the four main component or objective for advanced imaging. So as we know nowadays, they are talking about artificial intelligence. They are talking about all the machine learnings, all the precision medicines. So this is what this fall under advanced imaging. So the main objective of this advanced imaging is basically, first of all, we would like to have data standardization. So the analogy of the data standardization is if let's say a patient diagnosed with a particular disease, he or she underwent an imaging examination in one particular hospital, and let's say if she or he wants to go to another hospital for the sake of second opinion, that data that already acquired can be used without the repetition of the same examination on the patients. So this is what we call data standardization. So it's hard to be implemented especially in a country, because each of centers, most of the time they will have their own imaging protocol that they are familiar with. So this is one agenda of advanced imaging. So the next one will be the advanced computational and machine learning. So this is basically all about the computer system, where we're talking about supercomputer for helping or aiding the diagnosis or detection of the disease. So this is what we call in which radiologists now they are quite afraid with the emergence of artificial intelligence into the field of medical imaging. So the next one will be a high value imaging technique, where we know that there are a lot of technology being introduced, such as we only have 0.5 Tesla of MR scanning, and then we have 1.5, and nowadays we have 3 Tesla, and the latest one is 7 Tesla. This is what we call high value imaging technique. From the machine itself, the new machines will give us new sequences, new protocol that we can utilize to diagnose that a particular disease. So in fact, when talking in my field, when talking about PET-CT scan, there will be availability of the radio tracer or new radio tracer that be introduced into the patients, where the characteristic will be different as compared to the commonly used, which is FDG or fluorodeoxyglucose. And lastly, about the best practice imaging. I remember I attended a conference back in 2018. There was a presentation from the late Professor Sanjeev Gambe from Stanford University. He said, because the emergence of all the era of genomic or the genetic data, availability of genetic data, metabolomic, proteomic of all of the diseases, so we also can incorporate all those data into our clinical imaging data, where at the end of the day, by having all those information, maybe we have to change our common protocol. Let's say for a PET-CT scan, usually we perform for a particular cancer, we perform a whole body PET-CT scan, but with having all those information, maybe we don't need to do the whole body. We maybe can scan a limited area of the patient only. So this is what we call it the best practice of imaging, by having all those incorporation of all the data available into the field of our clinical imaging, medical imaging. So in terms of type of research, I would say there are 2 major types of research which can be divided into preclinical research and clinical application research. So basically, we're talking about preclinical research, we are basically aiming on the study of mechanism of a disease and the development and the progress of the disease itself. And we are talking about the detections and activity of receptor and pathway. The basic, I would say that the preclinical research is mainly about the fundamental of the research. So if we want to know about when we're talking about drug development, that's why we use animal model as to mimic human, in order we want to know the pharmacokinetic, pharmacodynamic of a particular drug that we want to use in the future. So in terms of imaging animal model, there are a lot of hierarchy that we have to follow before we can embark into a clinical trial. So I will say we will start first start with small animal, like from mice, rat, and then we will move to the rabbit and some of dog, and lastly will be the primate before we go into the human clinical trial. So for the clinical applications, basically we are trying to understand the pathophysiology of a disease and the mechanism of that particular disease in order to help in the diagnosis and staging of the disease. And then at the end of the day, those research is also to get the correct or right treatment that we can utilize for healing that particular disease or combating of that disease. So this is what we call response to target drugs or individualized therapies. So now we have a new term that we call translational research, in which we translate all the results from our labs into the clinical practice. So this is basically, you can see from here, the picture is just want to show all the lab analysis that we can do in the lab. Now we can move, by having all this data, we can move into the field of animal imaging, in which we use small animal to model or to mimic the human, and then we can introduce a disease into the animal for portray that result into the patient before we can translate or use it in a clinical setting. These are the concept where the in vitro image, all in vitro results we translate into the in vivo imaging studies, and then lastly will be in the clinical trial. This is the process that we have to follow. So let's say we can relate this, what happened in the worldwide with this COVID-19. So there are a lot of issues about the vaccinations, everything. But I would say it's almost with us more than 1 year. So still with this new coronavirus, still I would say it's still under study. So a lot of data have to be gained from all continents in the world. So that will help at the end of the day to kill or to overcome this COVID-19. So there is one more terminology that I would like to introduce to all of you, in which I think is almost it was first introduced in about 2010. The term we call it theragnostic. So the theragnostic is basically the combination of thera is for represent the therapy, gnostic represent the diagnostic. So meaning that we can have two separate protocols in one setting. So I just want to show you this is example of theragnostic. It's got already available in a clinical setting. So this is an example of a patient with a prostate cancer. When patient came to us, we'll do for the staging and the diagnosis, we can do the gallium-68 PSMA, stand for prostate specific. Hello, sorry.
That's okay. Yes, please go ahead, sir. Sorry.
Okay. I thought it's something. Okay. Sorry for that. PSMA stand for prostate specific membrane antigen. The 11 number is basically the receptor, the receptor of that particular antigen. So this gallium-68 is for PET scan. So this patient underwent PET scan for the diagnosis of his prostate cancer. So you can see from the image there are a lot of hot spots or lesions presented throughout his body, especially the bigger one. Yeah. And then after a month apart, so they decided to give, we call it PPRT, peptide receptor peptide receptor radionuclide therapy, PRRT. So this is basically giving the patient with lutetium 177. This lutetium 177 is basically an element that has gamma ray for the imaging purposes and also beta ray for the therapeutic purposes. So this patient was given lutetium 177 PRRT. So you can see from the image quite massive progress from the earlier one. So in which the lutetium 177 do his job, killing the cancer cell. And then after that, so this one I think sorry for the typo error, is basically about January 2016. So again, we give the second lutetium for this patient. So a huge progress where as compared to the earlier one, in which you can see only this one lesion remained there, and after about 3 months apart, the third lutetium 177 treatment was given to this patient, and we can see almost all the lesion already resolved, excluding this one. And then this one I would say is basically the inactive lesion. So that's why it remained there. So the era of artificial intelligence started from the emergence of computer-aided diagnosis. So I think maybe some of us already know about the computer-aided diagnosis, in which the CAD do all the auto segmentation, where you can see all the images, that you can segment it on base. If let's say you are interested on the disease, so or the lesion, so you can segment that particular that particular disease or lesion itself. So this is what we call computer-aided diagnosis. So by this is the era, the starting era of the artificial intelligence. So basically, artificial intelligence is the bigger subset of machine learning and deep learning. So by having a human input is basically from the clinical or from the clinician and also from the radiographer. This is what we call human input, such as the characteristic of the disease, the protocol that we want to use. So all this information is basically from the human. And then with the development of computer system, where we have new software available, then this is happening in hand together with human input. With this cooperation of human and software, you can with the advantages of artificial intelligence. At the end of the day, this artificial intelligence become new and interactive tool to the radiologists, especially in order to get an accurate diagnosis. So artificial intelligence and personalized medicine. Artificial intelligence can help improve image acquisition, decision making toward diagnosis, and suggest clinical intervention as well as drug treatment options. So what does it mean? Basically, let's say we imagine this in a rural area where the limited number of radiologists available in that particular hospital. So you have a situation, an emergency situation, in order to have a rapid decision. So sometimes the human error can occur. So that's why we have with the help from artificial intelligence, we can have the diagnosis earlier, in which we can give the prior treatment to the patient. So in that sense, we can, at the end of the day, we can give a better prognosis for the patient, and at the end of the day, patient can survive from the disease. So the next one will be the terminology we call personalized medicine. Personalized medicine is basically a combination of imaging data. We call it radiomic. We incorporated with all the data from the clinical, laboratory, and genomic, and then this is what we call it personalized medicine. Personalized medicine is similar. The meaning itself from the personalized medicine and precision health is almost similar, but I just want to give an intention. When we see the word medicine, is basically about the treatment, but when we see about the precision health, is about the lifestyle or precautions. So again, I just want to share with you about what the late Prof Gambe told us. Back in Stanford University, they already developed a home. They call it a smart home, in which that particular home incorporated with all the latest technology. Example, you want to sleep. There is a smart pillow. Then from the pillow, it can calculate how long is your deep sleep. So that's where our body is at a total resting stage. So remember, so this is the technology. So also on the mattress, there is a sensor also, one can calculate the ergonomy of your body structure. So it means what kind of posture that you should have in order to maintain the good body structure. So as same goes with the toilet facilities. They have the toilet bowl which can do the analysis of your urine every time you urinate. So it can calculate the pH, the presence of elements in our urine. So let's say if blood in the urine appears, or maybe some sort of residual appears in the urine, so that particular toilet bowl can do that kind of analysis. So this is where the emergence of technology, the smart homes, same goes with our latest, our new lifestyle, in which I think most of us have smartwatch. So those days, if you want to do the ECG, we have to go to the clinic. We meet the doctors, and then he or she will do the ECG, put all the electrodes on our chest. Then by doing that, then we can have the ECG. But now with the smart watch, we can have all our heart rate, our ECG, our blood temperature, our blood pressure, everything is available. We just with a single small tools, small gadget only. However, there are some challenges that we face with this artificial intelligence, especially in order to have one artificial intelligence that can be used throughout the facilities or the modalities. So at the moment, the artificial intelligence that we have only right for that particular machines and a particular disease only. So that's what the constraint of artificial intelligence, in which it has lack of high quality, high volume, and longitudinal outcomes data. However, to overcome this, we should have a standard way. This is standard way of this back as I mentioned earlier, the data standardizations. So this to organize data generated from different places, different practices is more challenging as compared to the AI-based medical imaging research. So this means we have to do a bigger picture to standardize all the protocol that we want to use within many hospitals available in a state of it. So the next one with the challenge will be related with the privacy and also the policy based on the confidentiality of the data. So this one issue become an issue where the teleconsultation nowadays, because of the pandemic, you can see a lot of teleconsultation available from in which you don't need to go to the clinic to see your consultant. You can do all the teleconsultation, but there is remember our security has to be good, because at any time the hackers can go into our system and steal all those information, and it happens. You can read from the news, there are a lot of hackers try to steal our information, and they do all those bad things on it. So this is what we call it, the privacy and policy have to be really look on it in terms of image sharings. At the end of the day, although AI can outperform human, but at the end of the day, I would say AI is mainly to help us to do the accurate detection of a disease rather than replacing us or human in the works, because we are dealing a patient, we're dealing a human patient. So that's why human, I believe, human is dynamic. So where at the end of the day, you can do the artificial intelligence for the imaging itself, for the imaging approach, but at the end of the day, to giving the treatment appropriately to the patient, we have to depend on the skill of like surgeons, all those specialists available. So this is why you don't afraid about the AI, although there are a lot of study where we can read that AI has become a threat to radiologists, especially the junior ones, in which they perceive that one day there will be no more job for them to be as radiologists. So that's why in Canada itself, when they did a survey to the juniors doctors, either they are interested to pursue in radiology, to become radiologists. So most of them said, because the emerging of AI, they think that at the end of the day, there are no job for the radiologists. So that's why we need to have a correct information what actually AI is about. I think the issue is pretty similar, in which the era of computed radiography and digital radiography. So basically, I would say it's pretty similar, where the intention of DR and CR is basically to help us to reduce the repetition of the images that occurred in conventional general radiography. So this basically just want to help us to improve our imaging facilities by having less number of repetition on patients. So this, at the end of the day, that's the main purpose of CR and DR. Same goes with AI. It actually wants to help the clinician or the specialist to do an accurate diagnosis, in which at the end of the day, when we have the accurate diagnosis of the patient, we can give an appropriate treatment to the patient, where the patient at the end of the day can survive and live longer. So the paradigm in medical imaging is from the current one will move from future possibility, where we can see at the moment all our current practice is driven by professional habit, time pressure, defensive medicine, and networks. However, in the future, they all will be the evidence based, where the data from the genomic data, the metabolomic data, proteomic data, all those genetic data will be available within our hand, and then we don't need to go to the detail of the detailed work, like so many lab works to be done to diagnose a disease, but we have all the genetic data, so that data will help will speed up the process. And then at the end of the day, we can have the scan that very specific to the particular to a particular disease, and then with giving us high value technique with shorter targeted protocol as compared to what we have now, lengthy technique or imaging series. That imagine a specialist or the radiologist, they will have so many sequences that they want to do, but with helping us those with helps of those technology available now, we don't need some such as lengthy techniques. And then the data itself nowadays only on the basis of qualitative, but in the future we might go to with the quantitative assessment, where we can have all the analytical tools mining data for more useful information. And at the end of the day, in the aspect of future imaging, we could say that we can have reduced number of imaging that patient have to undergo. At the end, we have precise diagnostic and treatment and a better life for the patients. Just want to share with you about some benefit that AI can give. This is quite recent in last month, where AI can, as we know that intracranial hemorrhage is an emergency situations where we should have a rapid decision for this particular situation. So by having AI, the algorithm can help the radiologist to identify the intracranial faster as compared to those days. So this is why the AI give benefits in terms of image or in terms of detection of the disease. So also related with this COVID, AI, a lot of studies available in which they are incorporating all this AI into the detection of COVID-19, because there is quite a classical sign of COVID-19. We call it ground-based glass ground opacity, GGO. So that's why this AI can easily identify GGO and differentiate it with other kind of lung infections. So it gives you an accuracy of about 94% with helping this deep learning technique and AI. We're talking much about the artificial intelligence. So now I bring you to another aspect of new technology in medical imaging. We call it 3D printing. I hope some of you have heard about it, 3D printing. So it basically already available in the field of architecture quite a long time ago. So for medical imaging, quite recently, they utilized this 3D printing into our medical approach, where they use the 3D printing to produce an anatomical model for those days for the learning purposes, but nowadays for the treatment purposes. So meaning that the model helps physicians and surgeons to enhance visualization of lesion, planning the surgical procedure, and at the end of the day, communication with the patient. So with the model, when the patient consult with the surgeon can show to the patient where is the exact location of the lesion for that particular disease that patient have. So that's why it's helping the communication to the patient, meaning that the patient can have a clearer view what happened to him. Let's say if the surgeon wants to do the surgery, so how the surgery will be done, which route the surgeon will assess, from anteriorly or from laterally or from posteriorly. So that's the idea of this model of 3D model can help to portray to the patients what kind of treatment that he or she will have. So this 3D printed model is usually very patient specific, and contain very detailed information to ensure it can fit accurately in patient's body, such an example of prosthetic. So let's say there are a lot of 3D printing being used for dentistry. So where they use those special material to do all those oral treatment for the patients. So the same goes with the like the orthopedic field, where they have to use the special prosthetic. So what shape of the prosthetic that should suit the patient? So this 3D printing will help the orthopedic surgeon to have an accurate shape of prosthetic that can be tailored into that particular patients. So this is an example I just want to show to you the image of conjoined twin. This from CT image, it looks like this, and then this is from the computer display. So by having this data, we can utilize all these two data, and then we can have the 3D printing model. So this is actually a good thing where it helps the surgeons to have the clearer view what the step that they should do in order to overcome this or to treat this disease, how to operate, which organ to spare, which blood vessel to keep or to put aside for a while, or to what kind of muscle that we can cut. So these are the information that will help the surgeon in terms of doing the surgery to the patients. So just this is basically how the 3D printer looks like. So there are a lot of 3D printer available in the market. So and definitely with a wide range of prices. And then this slide, basically, I don't have any intention to promoting Siemens, but I just want to show to you the era where we don't need to move the human, but we can, without moving the human, we still can perform the scanning with the high technology and high accuracy. So this is what we call, Siemens call it virtual cockpit. So they have a technology where the software for remote scanning assistance. So imagine if that particular hospital, they have the facilities or the machine itself, but unfortunately on that particular day, the staff has an emergency, so he or she will be on leave. So and we have the emergency situation where we have to perform that particular scanning for a patient. So how we can like let's say on that day only junior radiographer available. So how this junior radiographer can perform the imaging scanning for the patients. So by having this virtual so-called virtual cockpit, that particular junior radiographer can interact with another senior radiographer from other part of the world. So then that senior radiographer or application specialist can give a clear instruction to the junior radiographer what he or she should do. So this is basically the software, the workstation will demonstrate, will portray what the real you have in your workstation. This is what the concept of virtual cockpit. So this remote scanning assistance can transform care delivery and achieve a high level of standardization that leads to more accurate diagnosis. So if you want to read further about the virtual cockpit, you can log in into this web page. So this is the concept for me is quite interesting. So you don't need to move human, but you still can perform a good scanning to the patients. So before I end up my session for today, just want to share with you about our center. We call Center for Diagnostic Nuclear Imaging, located in University Putra, Malaysia, in which we have 64 PET CT 64, biograph 64 from Siemens. So meaning that the CT component is 64 slices CT together, incorporated together with the PET. And we do have also the 3 Tesla MRI, Siemens magnetom. So in terms of research that we are doing in this center, we are doing most of it, our works most about the translational molecular imaging, where we have the facilities for producing radiopharmaceutical by our own. We have the hot cell. We can do the dosimetry study where we have the TLD reader or fiber optic dosimeter. And for the imaging, as I mentioned earlier, we have the PET-CT and 3 Tesla MR. So the molecular part, most of our works are focusing on the cardiology using PET-CT and oncology and also neurology for the functional MRI. So we call our lab is Trans-MI lab, stand for Transnational Molecular Imaging Laboratory. So just recently, back in end of 2019, we have our own baby, our new baby. We call it teaching hospital, our own teaching hospital for our university. We call it Teaching Hospital of University Putra Malaysia. It's a 400-bed hospital incorporated with, equipped with most of high-tech facilities. We do have the robotic surgery. We have the SPECT CT camera here. We have another 3 Tesla MR here also, and the DR, CR, all those cutting-edge technology available. Most of it in our teaching hospital. So before I end, just want to share with you, this is all pretty similar with what we call it artificial intelligence. This is basically a work from our Master of Medicine. This is from our Master of Medicine student. He's now in the 3rd year. He's doing this all the machine learning, the deep learning. You do all those algorithm, do all the coding, everything. So if you want to use this so-called software, you can. It's freely available. Right? You can go to this web page and it's freely available. You can upload your DICOM images into the software and it can give you either this image abnormal or normal. That's only information that you can have. So let's say you have this for basically for the general radiography. So let's say you have a chest X-ray, you can upload this chest X-ray images into this software, and then the software will tell you either this chest X-ray is normal or abnormal. Unfortunately, it won't give you the information what kind of disease. So it's basically from our student works. So this just want to share the era of the students that should venture into the research, especially for bachelor degree students. So let's say we are no more about the traditional title of projects. So we can move with the new era of having all our students exposed with computer system, with computer engineering. So we can do a lot of works by collaborating from our medical imaging with all those people from the computer engineering. Lastly, this is all my references, and thank you very much for listening.
Thank you, Dr. Khairil. Was a very informative and I think it's a futuristic activities which you have discussed. All the professionals who are attending should be aware that this is the way the imaging sciences is going to go ahead in the future. Thank you for bringing in the information to our community. Dear audience, we have Dr. Hiral to answer your questions. If you have any questions, please type in the questions and I will be able to. Yes.
I stop the sharing or the screen?
Yeah, no, you can be there, sir. Let us take some questions. We have some time.
Okay.
Dr. Hiral, we have one question for you. Does the use of virtual cockpit allowed for daily practice?
Virtual cockpit, okay. So, can
allowed for daily practice?
Yes. It's already available in Europe, in Germany especially. Most of the hospitals they have this so-called virtual cockpit.
Okay.
So you can have I think you have a clearer view what is basically the virtual cockpits do. The virtual cockpit is basically helps us without having our expert in the field at the moment at that particular time. We still can perform the imaging on the patient. So this basically the issue that virtual cockpit overcome.
Thank you, doctor. Will be the same participant has asked that are there any guidelines for this use of virtual cockpit?
In terms of guideline, unfortunately, there is no specific guideline. But if let's say the institution can afford to buy it, to buy the facilities, so it's either you want you to utilize it or not. So basically, if let's say you can have a center incorporated with virtual cockpit, and then this is basically the service that Siemens can offer. So let's say a vendor can offer. So that at the moment there is, as far as I know, there is no specific guideline for the virtual cockpit. But this virtual cockpit is actually to help us in terms of overcoming the limitation of the staff.
Thank you, Doctor. We'll be waiting for audience to ask any questions to Dr. Haril. We would also be grateful for Dr. Haril to extend our gratitude and thanks for allotting your precious time and being available for this. This is an initiation which he has done. As the audience is aware that we are running a bachelor's program in the imaging sciences at Gulf Medical University, and God's grace, we are in the process of developing a master's program. And that's the reason which we are trying to initiate all these professional activities where we can bring in the international expertise to the local community, where the community of imaging sciences can get used to the latest trends and developments and also understand how the future of this profession is changing.
Yes. Thanks also from the organizing committee. So I would like to sincerely appreciate, thanks especially the dean of the faculty and also the head of the department, medical imaging sciences department, for having me and for giving me the opportunity to share. To share my a little knowledge about the research in medical imaging. So let's say if you want to have further discussion for me, you at any time, please feel free to contact me via email, or maybe, or I think the email will be the best.
There's a question for you, Doctor. Yes. How radiographers who work in the hospitals can participate in AI research?
Okay.
The role of practicing radiographers is limited in research.
Okay. So first of all, I personally, this is basically what happened to me. So research must come from heart. You should have an interest first. So if you have the interest, you can have a flexibility to work on your own. So meaning that when you have, you know that you like to do research, you should have first of all a good team. You should have a good team. So maybe you can ask somebody, especially like the radiologist, to help you to initiate the interest from you, where to start the work. So what kind of the issues that you want to tackle? That one I would say, do a reading. So from the reading, you can know what are the latest issues about a disease or about that particular modalities. That from there, you can shape your research directions. So that's basically, first of all, you should have the interest, and then you should have you don't work alone. You should have a team for that. So find another person, or maybe the senior one, to help you to grow, especially in the research. And then from that, you can slowly do the readings. When you have free time, do some of readings. So you can participate or attend a conference. That's one of the way you can have a latest update about the field. So what are the new technology available? What are the current practice? What should we change? So from that one, you can have the idea. You can bring back to your institution or to the hospital, and then you can discuss it further with your superior, your head of radiographer, or your head of the department. So you share all those information. So I strongly recommend for those, especially the juniors one. Let's say your student will be graduated soon, so they will be the junior radiographer. So even though you are junior, does not mean that you are not good, but the time will grow you later on. But you should have in yourself interest to grow, and then in terms of research. So you can have all those information, latest information from your reading, from watching all those website available, or the webinar series. And then by having all those information, you bring back to your institution, and then you can do slight changes slowly and gradually. So by having that, you can grow and become a success in the research, especially in medical imaging.
Thank you, Dr. Hiral. There is again one more question which is almost related to this. How we want motivate the radiographers to participate in the research?
Okay, I think that one is commonly asked. I almost most of the time when I give this topic, they will ask how to motivate. So unfortunately, I would say, because that's why I always say that research must come from heart. So because you don't put monetary reward on when doing research, because at the end of the day, researcher won't be the billionaire. Researcher won't be the millionaire. So in motivation, that's why I say you should have interest. By having the interest, meaning that you can see that is basically from my experience. I've been a teaching for quite a while, so we can have the grow. I can see my own how the profession grows. So from the diploma holder, then we grow in Malaysia. I'm talking this because it happened in Malaysia. So diploma holders, then we grow into the bachelor degree holders, and then we grow with all those master courses in medical imaging. So the motivation is basically not necessarily from the ministry. So let's say if we are looking in a public sector, so there is definitely the salary wise is almost similar across all those institutions, but the motivation itself should come from the practitioner. So either they want to change the profession or not, because those days we've been labeled with just a button pusher only. Just press the exposure button. That's we've been labeled with that. But with our spirit to change, and the motivation, we develop our own professions, and in which now we have a radiographer where we also can look what happened in the developed country like in UK, where radiographers they have the hierarchy or tier 5, you know, they have 5 tiers in the system where those radiographers can do reporting. Indeed, in the US, there is one course they call Master in Radiologist Assistant. So there is the course basically for radiographer to pursue. At the end of the day, they can do reporting, especially for the general radiography. So this is the motivation, I would say, is come from, we can have the motivation from the other countries' experience.
I really appreciate, Dr. Hiral, the way you are obsessed or passionate about your profession. Really, congratulations for that.
Thanks, Dr. Fabio.
Yes, this is what which we have been seeing, that the imaging sciences profession in many countries it is developing. That's an effort which we are doing at Gulf Medical University. That's the reason which we have started a bachelor's program, and inshallah we'll be starting a master's and also progressing further for a PhD program, because this is the way the profession grows. Otherwise, we will be left out like what you told as a button pushers. But ultimately, whoever belongs to this profession has to take the lead and has to try and possess the profession as their what do you call, mother, father, or a personal life. Only then the professional growth will go.
Yes.
So kind of you to encourage all the participants. The audience are requesting for your email ID. Would you permit me to share me,
sure,
or
sure.
you can type it in the PowerPoint?
I think it's in the first slide of
Can you just put the first slide, please? So that
yeah, this is my email address. Can you see it?
Yes, audience, can you see the email presentation? The Dr. Hiral has put his email ID is there for all those who are requesting. Thank you, Dr. Hiral, and we look forward to have further communications
Sure.
at the program level and at a professional level. And we will also try to make communication with you for any further tie-ups with research activities within the departments and at a professional level. Thank you very much.
Thanks, Dr. Praveen. And to all, stay safe, stay healthy. COVID is still around. Take care.
Thank you. Take care. Thank you, audience, for your active participation. Thank you, Hiral, for your excellent presentation, motivation, and giving all of us a lead where we can keep in touch with you on a regular basis. Thank you very much for the support.
Okay, welcome. Bye.
Thank you. Thank you, audience. We have our distinguished next speaker, Dr. Mohammad Abu Zaid, who is Assistant Professor, University of Sharjah. I would like to take the privilege of introducing sir. Basically, as we can see the link, what Dr. Hirar has said, how education is important and how higher education is going to help us to aspire in our profession, and how as imaging professionals, all of you will be able to progress in your career is what Dr. Mohammed sir is talking about. I take the privilege of welcoming Dr. Mohammed sir. Good afternoon and good morning and welcome, sir. Thank you very much for giving in your valuable time. One of the leader in this region in education of imaging sciences, mainly in the technical area. We have the privilege of sir talking to us about practice of radiography in the Arab countries, the current situation and the future. Thank you very much for giving us some time, sir. We look forward to have future activities and collaboration with you. You're muted, sir. One second. Yes, now we can talk, sir.
Good morning.
Good morning,
Can
sir.
you hear me?
Yes, sir. We are clear.
Okay. Thank you very much, and it's my pleasure to join your seminar. And I hope that the audience will get useful information from our talks. And thank you also to our colleagues who invited us, Dr. Wadah and his team, and for the other speakers also. It's my pleasure to join this panelist. I will share my screen.
Yes, sir.
Okay.
Yes,
Can you
sir.
see my screen?
Yes, that's perfect. Please go ahead.
Okay, thank you very much. My talk will be about the radiography practice in Arab countries. Sometimes I will put the word Middle East because it's the two terminology are sometimes are mixed in our region. But mainly I will talk about the current practice in the Arab countries and my perspective to the future practice. Again, thank you for the Gulf Medical University and all the colleagues and all the presenter, and for all the audience who are attending our topics. I'm talking from University of Sharjah. This one of the high-rank universities at the United Arab Emirates. University of Sharjah established at 1997, and currently we have around 14 colleges and more than 94 programs from the bachelor degree, master degree, and doctorate degree also. The medical diagnostic imaging department established at 1997, and our first batch graduated in 2002. We have students and graduates from most of the Arab countries, and our graduates now are taking a high role in different areas in United Arab Emirates and in many countries around us. Why I always I selected this topic, even though I talk about it in different presentation, in different conference, because I think the role of radiographers and the role of radiography education in our region is not well recognized. People, they are still confused about the radiographer role and the radiography education. And still we have many questions from our students about the role of the radiographers, the current practice, and the future perspective of this profession. So always talking about this topic is interesting to me, and I think it's one of the pillars which can attract the right and the highest high school students to this profession, and this is very important for the development of the profession in the future. I will talk about the title and the job description of the radiographer. I will also talk about the career ladder and progress. And I will talk about the postgraduate research opportunities and the importance of society and association in our region. And at the end, I will try to formulate some idea about how the future will be, the near future and the far future for this profession. Mainly, this is the three objectives, which is a job title, the qualification and the association. I'll try to link all of them together at the end. If we look to the definition of the radiographer, the radiographers or the radiological technologists or diagnostic radiographers, and in some countries also they name it medical radiation technologists, are the healthcare professionals who specialize in imaging of the human anatomy for the diagnosis and treatment of pathology. It's mistakenly known as X-ray technician in some countries, which usually I don't like to use this word, and I try my best to raise the awareness about avoiding using the word technician. This word is giving is lowering the value of this job, and at the same time it's drawing back the ability of the radiographer to develop themselves. You cannot compare the television programmer technicians with radiographer who are responsible about machines and equipments and patients and many aspects in the hospitals to produce highly quality images for the human body. As I said, the job title is different from country to another country. For example, in US, they name the radiographers as radiological technologists. The UK and the British system, they name radiographers. And for example, in Canada, they name them as medical radiation technologists. So internationally, it's very obvious that there is no agreement about one title. These heterogeneous in the job titles, sometimes it's really confusing, especially for the new generation. And it's also confusing when we are preparing in the future the job description of the radiological technologist or the radiographer or the medical radiation technologist. In Arab countries, we have the similar confusion. We have different range of names. We have the radiographer, we have the radiological technologist, we have the medical imaging specialist or medical radiation technologist. Sometimes they still naming the radiographers as X-ray technicians. Some countries now they start using the word consultant or specialist. These words, when you translate it to Arabic language, the confusion will be more. Yani it's not reduce the confusion about the title or the job title of the radiographers. Starting from فني أشعة, تقني أشعة. Sorry, I have to say this word in Arabic with respect to all other people here. In some countries, تقني أشعة أو فني أشعة سينية أو طبية، متخصص تصوير طبي، اخصائي اول، اخصائي اشعه، اختصاصي اشعه، استشاري تصوير طبي. In some countries in Tunisia, Morocco, and Algeria, they name the تقني الاشعه or radiographers as عمال التصوير الطبي. So the confusion become more and more when we go in different countries and when we try to translate the English to the Arabic one. So, do the job title mean a lot? Recent research indicated that the job title can affect everything from the level of physical or mental tiredness to identity. So yes, the job title is very important, and the job titles accurately reflect the profession chain, and it's used to define the employee role. It attracted the prospective generations, and titles are indicator of the salaries expected. This is also very important. Professor Daniel Cable from London Business School, he's found that the job title broke down barriers and allowed employees to better express themselves. And I found these questions, what is the title of the graduates? I found this question one of the most common questions that we receive it from the families and from the new students who join this program, not only in UAE, but everywhere. Usually they ask this question, what's our job title after graduation? What's the difference between radiographer and radiological technologist? What's the difference between تقني أشعة أو فني أشعة أو اختصاصي أشعة? So unfortunately, we don't use this confusion in the proper way to improve our profession or the profession in our region. And I think this is one of the most important goal for everyone working in this profession, to speak one language. We can agree on using the international system, which is more suitable than inventing a new title for the radiographers. Yani, in some countries, they change the name of the radiographer to اختصاصي أو تصوير أو اختصاصي specialist, medical imaging specialist, or medical. I don't agree, personally, I don't agree with inventing a new name and increasing the confusion. I think if we adhere to one of the international used titles and then work on the same trend to improve the radiographer job title, and to find out how we will improve this title in terms of qualification, in terms of experience, this will be better than inventing a new title like medical imaging specialist or medical imaging. I don't know how they translate it in English or in Arabic. It's very different, and it's very changing from one place to another place. So my personal opinion is I think we should adhere to one international system in our region, and then we will build on this system to improve the profession of the radiographer. One of the important things that we should think about it very carefully, the qualification framework for radiographers at different qualification levels. This is also it's very important, and again, we found that if we do a very simple comparison between the different programs available in different countries or inside the same country, we will find that there is no homogeneously. Each program looking to their graduates from their point of view, what these graduates will do in the future. So, for example, we found that some programs, they are graduating radiographers who are competent only. When I said competent, I mean 100% competent in general radiography. Some programs, they are going further, and they are graduating some radiographers who are competent 100% in general radiography and computed tomography, with a very minimal experience and education in some advanced modalities like the MRI or nuclear medicine and ultrasound. So this is also something that we should work on it, as academic institute and associations or societies responsible about the radiographer in the future. It's very clear that the academic degree available in our region, it's very confused. Still, we have some countries who are graduating radiographers with 2 to 3 years diploma, like Egypt, Syria, Algeria, Qatar, Oman, and Yemen. There is some countries who graduating radiographers with a bachelor degree, but 3 years degree. Many countries now move towards the bachelor degree with 4 years, and this is the most common now trend and the most common practice in most of the countries. When we talk about postgraduates, we found that the number of postgraduates for the radiographers is very limited. Sudan is one of the countries that started early started the postgraduates for the radiographer, and the first postgraduates, I think, in our regions started in Sudan. This happened in early 2000, and I think now the Sudanese graduates with a master degree and PhD degree working in most of the Middle East countries, and they got a wide acceptance in different countries. For example, the master degree of ultrasound, they got a huge acceptance in UK and in US and Canada. Saudi Arabia, Jordan, Lebanon, also they have started some master degree programs in different universities, which we can consider them as young master degree, which need more time to be mature and to fit with the academic and career ladder for the radiographers. We hope that as Gulf Medical University working in their master degree, also in Sharjah University, we are working on our master degree, and we hope, inshallah, in the near future that we will announce the first master degree in the United Arab Emirates. We are not competing with any with Gulf Medical University, but we are working together at the same level to make the radiography education attractive and to develop this postgraduate degree for the radiographers. PhD, I think the only countries that available PhD for the radiographers is Sudan. So we can see that there is a wide variation in study duration, curriculum format, clinical practice, and internship. Some undergraduates concentrate only on medical imaging, and they have branches of radiotherapy and nuclear medicine. And some programs, they have different tracks for the medical imaging and radiotherapy, medical imaging and nuclear medicine, and radiotherapy and nuclear medicine. So there is some variation. Again, this variation is good if we agree on standard, if we agree on national qualification or in regional qualification for the radiographers. This will help a lot the development of the profession. One of the observations that we noticed from our working and from our experience, that in one country you have different bachelor degree programs, and the graduates from the similar program, they have they completed the similar qualification, but they have different practice skills or different practice area. So the same graduates can work in MRI. The other graduates, he cannot work in MRI, for example. And this is also one of the observations we should take care about it, because it's very important when we are graduating, if we consider the graduates as a product, to ensure that this product are at the same quality. All the products we have it at the same quality. It's not acceptable that we have one graduate who is competent in MRI or ultrasound or nuclear medicine, and the other graduates, no, they cannot do this, because this will reflect it back to the academic institute in the future. It remains at the decision of the relevant authority in each country to establish a minimum level of education, and this is very important, but it should be in consultation with professional societies. Later on, I will talk about professional societies, and together with professional society and radiographers, to outline the professional role of the radiographer in their country. Now, do we need independent radiographer associations or societies? And what's the difference between association and society? In our region, when we talk about society or associations, many things will come to our mind, starting from the academic to the social, to unfortunately the political societies or political associations. And we should be very careful when we use these terminologies. But generally, the society or associations for the radiographer is the profession organization body. It's responsible about conducting educational workshop, conference, in collaboration, of course. If any educational activity organized by a professional body and in collaboration with educational institute, the value of this education will be more, and it will reflect more to the profession. It will weigh a lot. If we compare, for example, any activity we organize it, for example, in United Arab Emirates by the Gulf Medical University or by University of Sharjah, to, for example, to any conference organized, for example, the EFRS or the ECR, we found that the professional body had a strong connection with the universities. So they knew the needs of the radiographers, and they built the optimum educational workshops or conference. Of course, support the professional rights, review the status of the radiographer professions in terms of legal, administration, standard qualification, and skill to practice, and facilitate the link with international and other national organizations. This is very important for the radiographers, and unfortunately, I can say, again, this is my personal opinion, the societies in our region, the association of in our region, the role is not clear, the organization is not clear. Radiographer underestimate the value of these societies or associations, and some of them, they are working in different in different objectives or goals, which is not their own real task and objectives. So these three things together, the job titles, qualification, and association, is building the current practice of the radiographers. And it gives us three kinds of radiographers. I can name them the turtles, the racehorses, and everyone else. The turtles, this is a slow, steady, solid, very tentative to details, unhappy with the change and pressure. And you can see many radiographers, they are turtles. Yeah. Some of them, they are from the new generations, newly graduates, and some of them, they are the experienced radiographers who reach to the point that they feel that they cannot do more, and they are unhappy with whatever happening in this profession. Everyone else, this is sometimes they are fast, sometimes they are slow. They like to work on the comfort zone. They don't want to challenge anything. They just do their work. They don't challenge themselves. They don't find out how they will improve their career or their professions. They don't have a clear vision for their future. And this is This is one of the things that we lack in our profession. If we compare our profession with the medical doctors, we understand that once a student came to the medical college, he will build some interest that in the future he want to go for a specific specialization, which country you want to go, which fellowship you want to obtain, which degree you want to do. But in our profession, it's not clear. Even though the new generation, they have the enthusiasms to do many things, but when it comes to the real life, they are stuck. So we have the race horses, also they call the vacuums, and this is also part of the radiographers who got the chances either to go for postgraduates or to get some scholarship to travel outside, or they finish some international board like the American board of sonographers, or they obtain Canadian board, Australian board. So this is we can consider them the race horses who are doing a lot for themselves and for the professions. So how we will influence the change? We have three things. We have this personal, social, and structural. And in each one of them, we have a motivation, and we should also concentrate on the ability. But always we should look carefully who is responsible about each part, personal, social, and structural. The motivation for the personal is them to like what you don't like. This is very important. And I always say to my students, if you found yourself in a career or in a degree that it's not fitting your capabilities or your dreams, but you're stuck in this profession due to scholarship, due to the availability, due to any other motivation reasons, so you should like it. Because if you don't like it, you will end it by joining the turtles group. We always try to find the positive pressure, not the negative pressures. And the structural is very important because it will help the personal, it will give the rewards, and it will help the personal accountability for each other. And at the end, it will set up the supportive environment. Job opportunities, this is one of the things that we always should consider it, especially when we are preparing the newly graduates, the students for their future career. I found these two elements, or these two jobs, radiation safety officers and PACS administrator, is the challenge for us to graduates, radiographers who are able to practice radiation safety officers or to be PACS admins. In each one of these two jobs, the radiographer, he should be very competent to compete with other professions. Radiation safety officers, we need to compete with medical physicists. They have more knowledge about the radiation protection, radiation measurement, but we are, as radiographers, we are able to compete by making the undergraduates strong enough, and we should also have some continuous professional developments or continuous medical educations to allow the radiographers to be the radiation safety officers in the hospital. This will change how the people will look to this job, and it will definitely improve the radiographer self-esteem. PACS admin also, we are competing with the IT people and some of the medical equipment engineering, for example, but still the radiographers are able to compete, and they did a good job as a PACS admin in many different hospitals, not only in UAE but everywhere. And the future is happening. It will happen. It will come soon or later. If we are here, if we are not here, if we accept the change or if we resist, the advanced practitioner radiographers. We are not, in terms of radiography profession, we are not the pioneer, we are not the leaders, we are followers. And most of the countries realize that the radiographers, when I said most of the countries, the first world countries, let's talk about UK, about the US, about Australia. These countries, they realize that the radiographers can participate in image reporting, in image commenting, whatever terminology you want to use, either commenting or reporting or image interpretation, the radiographer can participate. Under supervision, after completing specific education at a specific area, for example, in emergency, musculoskeletal, CT brain, ultrasound. But this change will happen, and the artificial intelligence will help the radiographer to reach to this goal in the near future or in the far future. I'm not sure when it will happen, but in the universities, this is a message to my university, to Gulf Medical University, to any other universities. We should think carefully that we to prepare the graduates to be ready for this task in the future. Messages for the radiographers: advance your knowledge. Earning the PCC is a big accomplishment, but it will not take you far. Earning the master degree can open doors and elevate your career to the next level. Earning a PhD will create your history and shape your professional futures. Message number 2, you should be a leader. We just talk about the different, me and my colleague, we just talk about the difference between the leader and the manager. And we think that we need some leaders in this profession. And then later on, every radiographer, he should be a leader by himself. Represent your profession well. This is also very important. Take it wherever you go. Speak to the community about the importance of the radiographer role. Talk about your experience. Talk about your future, about your promotion, about your plans. This is very important. And take time for yourself. And it's very important to know how to learn how to say no and when to say no, and to reduce the stress and the fatigue from this from the job itself. Especially nowadays, we know that the radiographers, they are the front line during this COVID pandemic, and they work for long hours and a lot of pressure, and they took a big role in the diagnostic of COVID cases by doing the chest X-ray or by doing the CT scan, and the radiographer should learn how to reduce the stress and how to prevent themselves from the fatigue. Never stop learning, okay? Do whatever you can do. Ask for help. Don't miss any opportunity about any education or any learning activities. And don't always be the one who are receiving the education. Try to educate. Start by the students, start with your colleagues, and then you can start to speak outside. Never give up. This question at the end: radiographers are intelligence, kind, integrity, attractive, and this is a kind of the multiple choice that is very confusing to the student. If we ask the students this question without adding number 5, which is all of the above, the students will say that this is a bad question. So my opinion is that radiographers are intelligence, kind, have integrity, and this profession is attractive. This is my reference, and thank you for everyone who supported me all the time. Thank you for everyone I forget to thank him in the real life. And this is my contacts. I'm ready to, I think I didn't take a long time. I will keep long time for discussion and questions if there is any. Thank you very much.
Thank you, Dr. Mohammed. It was indeed very realistic presentation, and how people belonging to this profession should always dream of. Very happy to having heard to you and understand how the profession can go ahead. All audience, now we are open for questions to Dr. Mohammed. If you would like to ask any questions, please type in, and I'll be more than happy to convey to sir. Thank you, sir. We'll just wait for a few minutes for questions to come in.
Thank you.
Audience are conveying their greetings to you, appreciating your lecture. Very nice lecture, doctor. Thank you very much. God bless you, doctor. So I can see all good applause for you.
Thank you very much.
I believe there is a lot of similarity in the first three lectures which have been happening. The first lecture, the first presenter who spoke about how to practice ultrasound, the second person who spoke about research activities, and you as an academician trying to highlight as to what will be the future aspects. It's a very good forum I am feeling from the morning, because all the professionals are thinking the same lines. I'm privileged and delighted to coming in touch with you. Thank you, Dr. Mohammed. Thank you for the presentation.
Yeah, I think this is a trend now at the region, especially many universities are looking forward to have their postgraduates. To have a postgraduate, it's very important to raise awareness about the profession. And again, we should always talk about the career ladder and how this profession will be developed. Otherwise, we will end it by academic degree, postgraduate degrees, but the work environment, the job descriptions, the task of the radiographers are similar. So we should raise the awareness, and we should always work with stakeholders, with associations, radiographer association, organizational body, to build the profession and the career.
There are a few questions coming in, Doctor. Dr. Mohammed, how do you see the future of radiographers?
The future of radiographers in our region.
Yes. Yeah, how do you see the future of radiographers?
I think if we talk about Western countries or UK or US, the future is very clear for them. The radiographers, they are moving towards the advanced practitioner. In our region, we need first, as I said, first we should have qualification framework. We should have strong societies or association. And then the radiographers themselves, they should build the interest in research. This is very important. And I think we should also collaborate together, universities, stakeholders, to find out how we will make this career attractive. For example, when we talk about the advanced practitioner in our region, for example, let's talk about UAE. Because as we are a part of this country, and this country is supporting us with many facilities, and they make the resources available for us. So one of the things that this country, for example, UAE, talking about it in every moment, then nationalizations or tawteen. This job as radiographer job, 100% it's not attractive for the UAE nationals. It's very clear by the numbers. If we compare the numbers of the radiographers working in the hospitals, the nationals and non-nationals, we will find the big difference in numbers. The numbers of students. So 100% is job or this profession is not attracting the national to join it. So we should think how we will make it attractive. One of the things that it can make it attractive is the advanced practitioner, the radiographers, advanced practitioner, the radiographers who can work as PACS admins and radiation safety officers. So this is the future. Nowadays, many of my colleagues, for example, when I studied the technique, we were doing many projections, which is now is not done. It's replaced by advanced imaging modalities like the CT or the MRI or the ultrasound. So things is changing, and we should change also ourselves. Otherwise, we will come at the end, we will find that the machine doing all the work, and we are just operating the machine. So we should raise our knowledge, our skills, and our practice role.
Thank you, Doctor. There's one more question. Will radiographic technologists write reports one day? It's a question. They are seeking your guidance. Will it be possible to see a day where radiography technologists will write reports?
See, when, I don't know. To be honest, it can happen at any moment, because sometimes in our region, things is not like we have to do a need assessment and then we have to do study. But in our region, sometimes we need a decision. Radiographers can report. So everyone will work to make it real by changing the curriculums, by changing the job descriptions, by changing the professional role of the radiographer. How? This is our job together. Universities should prepare the graduates to be competent to practice in image reporting, either at the level of undergraduates or the level of the postgraduates. Body associations should work with the stakeholders to inform them that if the radiographers are reporting or participating in reporting, this will be enhancing the manpower utilization. This will reduce the cost. This will improve the healthcare delivery in the imaging department. Radiographers should show the interest. At this moment, I knew many radiographers, not radiologists or medical doctors or professors. Many radiographers, they are against the radiographer role in image reporting. Even in our close area of friends or colleagues, there is many radiographers, they are against this idea. So we should raise the awareness. We should tell them this task, it's not impossible, it's difficult. We have to study, we have to learn, we have to work under supervision, we have to take responsibility, we have to take the medio-legal aspects. It's a group work together, team work together, not one-man show. But yes, the radiographer will report one day.
Inshallah, inshallah.
Yeah.
Thank you, Doctor. There's one more question. Good afternoon, Doctor. We love the presentation and the future that this profession holds. One of the things that the graduate face is lack of proper hands-on experience in different modalities such as CT and MRI. Do you think UAE should introduce registries like the West, such as CT registry or MRI registry, to help the graduates specialize in different modalities before they can enter practical working environment?
Hands-on training, yeah, we are facing this difficulty. Maybe in University of Sharjah, the number of students are increasing, and we have many facilities for training, but the number of patients is reduced in all facilities, especially in the last maybe last year with this COVID pandemic. I hope the simulation will play a role in the training, but again, the universities, the societies should find a way that to increase the hands-on sessions, training, hands-on training on patients, and the radiographers themselves. They should fight to find opportunities.
Thank you, Doctor.
There's many challenges, but it's very difficult. Regarding the registry, the CT and MRI registry or the ultrasound, it will come, but again, it will take a long time. My advice to my students, for example, if you like to work in ultrasound, you should find after graduation, you should find immediately postgraduates. This postgraduate course or postgraduate diploma or master degree, try to find, try to get the registration, international registration, especially one of the most recognized one now is the American Board of Sonographers. And they come in different categories. If you got the chance to skip to US, then you can do the American CT or MRI registry. If you can go to Canada, you can do the nuclear medicine or MRI medical technologist registry. And I think now the UK joining the HPC is one of the opportunity that everyone should take it. At least if you will not go to work in UK, that you will show that in your CV that you are eligible to work in UK.
Thank you, Professor. There's one more question. Does the current curriculum equip the students for the future?
Yes, yeah, the current curriculum, let me talk about University of Sharjah. We changed the curriculum in 2-3 times in the last 10 years. For example, in 2010, we included the PACS courses, which is preparing the students, the graduates to work as PACS administrator. And we have many of our graduates working as PACS administrator everywhere in the region. We work a lot with a radiologist working with us. She's a faculty member to improve the radiographers or the undergraduates' role knowledge in the pathology and cross-section anatomy. So we hope that we think that our graduates are competent in different cross-section imaging modalities and in radiographic pathology. We will change our curriculum very soon also to integrate the artificial intelligence in the curriculum. And this is one of the most important things which it should be integrated in the curriculum. I'm sure many universities, Gulf Medical University also, they have the vision for their graduates and for their undergraduates. The problem of the curriculum that the changes will not happen to the person who graduated. The changes will be implemented on the newly admitted students. So sometimes the graduates, after they leave, they feel the deficiency. Maybe they don't have artificial intelligence skills, they don't have radiation safety officer skills. So they have to work on this deficiency by themselves in collaboration with their societies, with their hospitals to build this deficiency. But I'm sure the newly graduates or newly admitted, they will have this skills.
Thank you, Prof. There's one more question. Nowadays, we hear nurse-led diagnosis. Is it possible to see radiographer-led service delivery?
The nurses, they are nurses. They are strong fighters, and they are, most of them, they are women, and women, they are very good fighters, and they are a majority in the healthcare system. So you will find them everywhere. Now there is something called the advanced nurse practitioner.
Yes.
Which even they are doing some in different countries, the nurses even they do some reporting, they do some diagnostics after they get some courses, especially in the areas that they don't have physicians. And for example, in the ultrasound, in different countries, in some countries, we found that some nurses, they are enrolled in the ultrasound course, they can do ultrasound. So yes, we will find radiographers who are practicing and they are reporting one day.
Thank you, Prof. There's one last question. Professor, do you think creating or being part of societies would help the radiographers transition into radiation safety officer or PACS admin post? Or would providing additional diploma courses for the same at university be a more practical solution to this?
The role of society is very important, again. And it's not, it's underestimated. The role of societies in our region is underestimated. I'm not sure about, I don't want to talk about the Radiographer Society in United Arab Emirates, but the society should not be only academic society. It should be an organization, body for the profession. Look to the College of Radiographers in UK. The College of Radiographers in UK is the organizational body which organizing the radiographers practice in UK. They do need assessment for any things. They do research. They participated in conference. They motivate the radiographers to do their own research. They to do advanced practitioner. They help the NHS to improve the radiographer role in the hospital. So we need a society that it's not only academic society that will organize small conference once a year, or the society that is doing some social activities. No, we need a society that organizing the profession and lead the profession to the future. Talk to the universities, tell them that your graduates is good in this, is bad in this. This is our future aim. Society is very important, or association, whatever term you want to use.
Thank you, Prof. There's one more question, Professor. Do you think that artificial intelligence will replace radiologists in the future?
No, no. And this is we should understand it very well. Artificial intelligence in medical, it will not replace any manpower. It will help the manpower to achieve their goal, to deliver best healthcare services. We know that the robotics now help in surgeries, but this robotics is driven by physicians.
Yes.
Artificial intelligence will help in diagnostic, and this is not, it's not something new. We have the CAD, computer-aided diagnosis, or systems which is available since maybe 1985. Artificial intelligence will help in diagnostic. It will reduce the burden on the radiologist. Maybe they will concentrate more in difficult cases. Maybe they will concentrate more in interventional radiology, like biopsies, like cardio, like special investigation, but it will not replace. Definitely, the number of radiologists, new radiologists, will be reduced less in the future, especially if the physicians depend more on the artificial intelligence and the physicians are able to do the diagnostic by themselves. So maybe we will see the number of radiologists is less in some countries. And there's many elements. I don't want to go in this area. And in some countries, the radiologist, there is a financial conflict of interest. So in some countries, the radiologists will not allow artificial intelligence or radiographer to do image reporting because there is some financial conflict. This is something else we can talk about it under the table later on.
Thank you, doctor. There's one more question. How can I improve my knowledge to be ready to write reports, especially in X-ray?
Read. Study.
Thank you.
Yeah.
One other question for you, sir. Is sonography a good career option?
Yes. Of
Thank
course,
you, sir.
sonography is very important. And now I think the sonographers, even they invaded before when we learned ultrasound in 90s, they told us ultrasound enemy is air and bone. But now the ultrasound has a role even in the imaging of the maybe the chest, for example. So ultrasound is booming, is advancing, and they have different specialties. We can see now some sonographers specialized in vascular, some sonographers specialized in musculoskeletal, some sonographers specialized in small organs. So yes, this is one important fact.
Thank you, Professor. Thank you very much. It was indeed a very interactive session. Sorry, there's one more question which is coming up. Dear doctor, what about cardiac catheterization radiology?
Do they mean technologies, cardiac catheterization technologies?
Yes, yes.
Yes, it's one of the things, one of the area that the radiographers can play an important role there. But there is many limitation, and there is many people involved in the cardiac catheterizations, whom are cardiologists, radiologists, nurses. So the radiographers who work in this place, you need to be distinguished.
Thank you, Professor. Thank you for your patience and answering all the questions, which was very interactive. As we can see, most of the young aspiring imaging technologists are trying to talk to a senior most person available in the country, I feel. Thank you very much for your time and accepting our invitation and contributing. Well, inshallah, we'll work together and we'll be able to succeed much more things in the future also.
Thank you very much. Thank you.
Thank you, sir. Thank you very much.
Bye. Assalam.
Thank you, sir. Assalam. Thank you, audience, for having all your questions. May I have the privilege of introducing Dr. Ahmad Abdul Rahim Muhammad Ibrahim, who is a professor in Faculty of Radiological Sciences in Al-Zahari University from Sudan. We have the privilege of introducing Sir, and Sir will be talking on his topic. Assalamu alaikum, Professor. How are you? We can't hear you, sir. Just a second. Can you hear us, sir? You are not muted, but can you just mute and unmute yourself, sir, once? Just a second, sir. Can you speak? Can you hear us? Can you just remove the headphones and put it once again? We can't hear you. Can you remove this and talk? Hello? Can you hear me, sir? कॉल करेल just a second, sir. Trying. Dear all, because of some technical error, I have shared one Google link. We will conduct the session on that. Can you all please join the session on the Google link which I have shared? Sir, please join on that link, sir, which I have sent a message to you. Dr. Ahmed, sir, can you join on the link which I sent to you in the message? That's a Google link. We request all the participants to join into the link which I sent. Sorry for the confusion. Some technical error is there. Sir, you can leave this session, sir. Please, we will conduct in the Google Meet.